Stephen, good to see you.
Good to see you,
Thank
Maria.
you so much
Thanks
for joining us this morning.
Thank you.
And I've been following the growth plans that you have in place at Quest. You've been very clear to the investor community how you want to revive growth at the company. But I want to kick it off with President Trump's plans, because business leaders seem to be happy about this corporate tax plan. You say?
We say, first of all, on the healthcare side of it, we're all anxious to see what happens. But the good part of the Affordable Care Act is actually about 20 million lives were added to the healthcare system with insurance. And simply, when people have healthcare insurance, they need what we do. And so we're hopeful that that will continue with the Affordable Care Act. Secondly, is we get paid for Medicare through what's called the clinical lab fee schedule. There's an orderly process for reviewing that. And we're hopeful that that will be refreshed in 2018, so that's good news. And then finally, Maria, we're a small fraction of healthcare costs, around 2% of healthcare costs, yet we represent around 70% of healthcare decision-making. So our view is we could be part of the solution, better quality healthcare at a lower cost.
You know, there's been a debate right now in Congress that you can't repeal Obamacare without having a replacement. What should a replacement look like from your standpoint?
Well, I think that, some people would agree with the fact that some parts of the Affordable Care Act were good. That is, people with insurance is a good thing. Second is the portability, the ability for pre-existing conditions to be covered is a good thing. 26-year-olds being able to stay on their parents' program is a good thing. But it's all about quality and cost and accessibility, and all three elements have to be part of the new way going forward.
Yeah. In terms of the corporate tax plan, do you think a 15% corporate tax rate would change behavior in terms of, this was a question that I asked Jamie Dimon earlier in the program, would we see companies say, okay, my earnings are going to be up 20% as a result of this 15% corporate tax rate. I'll reinvest that money. I'll hire more people. I'll put the money into the business. What do you think the impact?
We'll see what happens. If it happens, we're a full-pay taxpayer. If you look at our corporate tax rate, we're full pay. We have very little international entities and very little international presence. And so if something were to reduce our tax rate, we'll then have to address it with considering how much we get back to shareholders and how much we potentially invest.
I mean, the tax story has impacted deal flow. It's impacted so much. One of the reasons, obviously, Pfizer almost went and moved to Ireland. Right. So I wonder if it dictates.
Well, it changes the economics. And, as I said, if it happens, we'll take a deep step and take a deep look back at what we've done in the past and consider other alternatives going forward.
Let me ask you about one of the obviously big issues that we've seen at Quest. And back in late November, Quest Diagnostics, data was breached, exposing patients' names, dates of birth, lab results. It was pretty extraordinary. Stephen, talk to us about that. What happened? Has it changed the way your company operates?
First of all, we're all over cybersecurity and making sure that the information we have is protected. And the interesting part of our business, about 50% of adult Americans actually see Quest Diagnostics in the course of the 3-year period of time. And that information was actually breached for one of our consumer-oriented applications. About 34,000 people lost some of their records to this breach. However, no confidential information, health security numbers or credit card numbers were in that. And if you put it into context, over the course of a year, we see 150 million people, and we keep that data for about 10 years. We got 20 billion data points, so we take it really seriously. We understood wouldn't it happen. We reported it to the authorities, and we're all over making sure we learn from it going forward.
Right. Look, you've done everything right when faced with a disaster. I mean, we know that, but this is an issue, right? I mean, how much do you spend on cybersecurity?
We spend a lot on it.
Yeah.
It's an active part of our compliance program. It's an active part of our audit committee.
Do you think that number goes up? And will you have to get... I mean, Jamie Dimon on the show earlier says they spent $600 million on cybersecurity. He says, we know what everybody's doing. We know when they're doing it. We've got to.
Yes, we actually are all over it. And there's, we have to learn from all that we learn every day and apply that to new ways that you can get breached. And we actually have a special authorization from Homeland Security that allows us to gain insight of what's happening throughout the world because we're such a critical part of the healthcare infrastructure. So that credential helps us get smarter going forward than we are today.
Let me switch gears to ask you about Theranos. Last week, Theranos announced it's going to be firing 41% of its employees. This is the second round of layoffs. Look, we know what's gone on at Theranos. Blood testing company has obviously been under scrutiny for the accuracy of its tests. What's your reaction to this?
It's a complicated industry, and we have a lot of competitors. And I think as an example, of the complexity of this industry to get it right in terms of laboratory testing and diagnostic information systems. I won't comment on a specific competitor, but what I'll say is that we've been in this industry for a long time. We're proud of what we do. We're a fraction of healthcare costs, and we do a great job of it every day.
Look, the Journal broke the story. Was it the right move for the FDA to say, hey, wait a minute, stop what you're doing right away?
Well, we're actually interestingly controlled and have oversight from CLIA, which is part of CMS. And in addition to that, there's a portion of the laboratory industry that's being overseen, if it's a medical device, by the FDA. So in this case, the FDA looked at this product that was being introduced and asked the question, has it been properly gone through its verification process, and therefore, in what they do in managing a device industry and what they do applying it to this company, I think there was reasonable oversight there.
So you're here at the J.P. Morgan Healthcare Conference. You must come all the time.
Yes.
It's an incredible conference,
Yes,
10,000 attendees. What I find interesting is that deals happen at this conference, right? We've seen
a lot of discussions, yeah.
Yeah. So what about deals for you? I mean, 2015 was a record year for healthcare deals. Are we going to see that in 17? And what are your plans?
We're in the middle of the ecosystem, so we work with all the healthcare insurance companies. We work with all the providers. We sell to 50% of hospitals. We work with many providers of technology that we use as we deliver a solution.
Do you need to merge to get bigger? Do you need scale?
You know, part of our growth strategy, you asked me when we started about our growth strategy, is to look at 1% to 2% revenue growth through acquisition. So we are consolidating. And so we find those organizations that would benefit from our scale and bringing it to Quest Diagnostics. So it's a portion of our strategy is consolidation in this industry.
Like sort of tuck-in deals.
Yeah, smaller deals. 1% to 2%,
right.
Which is reasonable size, but it's aligned with our strategy of diagnostic information services.